And a new law was passed which now requires private insurance companies, Medicaid and DC Healthcare Alliance to cover fertility diagnosis and treatment, and it's often a costly and burdensome process. Now, our contributor Mark Hall joins us as he speaks with the sponsor of the bill, at-large Councilmember Christina Henderson. Hey there, Mark.
Tasmin, thank you. And Councilmember Christina Henderson, welcome to Capitol Review. Let's get started. According to the National Institutes of Health, 9% of men and 11% of women in a reproductive age experience fertility issues. Black women in particular oftentimes experience infertility at higher rates than white women. Talk about how important this bill is.
Yes, well, we know, from the statistics that you provided that lots of individuals are facing issues in terms of being able to start their families. And yet for many of them, when they learn that there might be an option that can help them, it is the price tag that is, again, another barrier in order for them to begin their journeys for their families. And so we believe that infertility is a medical diagnosis, and your medical insurance should cover the treatment options to help you overcome that.
A couple that we spoke to a while ago say that those treatment rounds cost anywhere from $20,000 or $30,000 per round. I know you touched on that. How will this legislation really help people wanting to start a family?
Right. So for those with private insurance, this legislation would require that your insurance company covers up to 3 rounds without the additional limitations or tests or barriers that some insurance companies might put into place. It also covers the transfers for embryos as well. And what's particularly important for residents in the district, where we have a large number of LGBTQIA families, this legislation would also cover third-party transfers as well. So this will allow for those couples to also be able to start their families through surrogacy.
Councilwoman, why are you so passionate about this? Why are you behind this effort?
Well, the idea originally came to me from a very close friend of mine. For she and her husband wanted to start a family. That was always wanted to be a mother. And no one ever anticipates that they're going to have fertility challenges when they want to begin to start their family. And frankly, for her and her husband, they had to decide between, are we going to buy a house or are we going to try to pursue this option? Luckily for her, her husband was able to get a new job in New York State where this insurance coverage is already required. And she was able to, go through the rounds that were necessary, and they have a beautiful baby boy today. I've heard from plenty of women who in the district or even in Maryland, so they're former district residents who moved to Maryland because this is something that Maryland includes in their insurance regulations, or who are taking second jobs at places like Amazon or Starbucks because the corporate companies do offer this benefit as part of their insurance packages as well. For me, I don't think it should be something that is only limited to the wealthy few and their ability to be able to receive a true diagnosis and then also options around treatment to begin to start a family. It shouldn't be for folks who are only making $1 million or above.
And when can we see this go into effect? What are the next steps?
So once this is all approved, it has to go through the congressional review process, which I'm sure you're familiar with at this point. But once it's all approved for private insurance, the coverage will begin in January of 2025. I know that seems late, but we had to provide some ramp up time and notice to the insurance companies to get it into their materials and build it into their rates for 2024. And then for individuals who are on Medicaid or under the Alliance Health Program here in the district, they have a bit of a modified coverage, which will be diagnosis and medication, and that will begin in January of 2024.
Councilmember Christina Henderson, thank you so much for joining us on Capitol Review.
Thank you for having me.
All right, Mark, thank you.